do whatever you want to do. We don't care for anybody. That's it. We don't care for someone. We are free to do. We are do whatever we shall do our way. We shall not listen to anybody. This is my kingdom, and I do my way. Who someone is there to tell me what I should do? No, I shall not do. I am responsible for myself, and I'm not responsible for people. This is my objective. This is my principle. This is my philosophy. I am not going to listen to anybody. Why should I submit to someone? Why should I improve my performance? My performance should be to my satisfaction, not to your satisfaction. That's what I say. This is my statement. मैं जैसा चाहूँगा करूँगा, आप कौन होते हैं कहने वाले? मुझे किसी की कोई चिंता नहीं है. जैसा मुझे अच्छा लगता है मैं करूँगा, क्योंकि मुझे अपने आप को संतुष्ट करना है. आपसे मेरा कोई लेना देना नहीं है. मैं भारत का राजा हूँ और आप मेरे गुलाम हो. This is Suraj Singh. Good morning to everybody. Speaking from Bharat, India, regarding COVID-19 status. I try not to give today, but because of some reason I again come here to see, because yesterday very few cases have been reported, and surprisingly it's too small number. Very small number. Can say if you go to file, you can see this file 26,567 positive cases have been reported. 26,567, just a down about from 32,981 yesterday. And what a beautiful design it is. Really, I appreciate their beautiful design in the way that they want to show to people, see, we are achieving progress. Yes, you are achieving progress in manipulation. You are achieving progress in issuing and publishing false statement of false information. And here it is clear proof that you dropped cases. Yesterday it was 801081, and today it's just up, and that's 1026, but far down in previous statistics. That's the problem here. How many percent you've gone up? You just see here. I'll just show you how many percent you've gone up. And what I want to show, if you see IAT minus 183, I say IAT, if you say here, you can say how many percent up here? See here, I can say here, let's say this, this minus this, minus this, here is this, equal this, and if you take this here, you can say this here, and you will get this answer. 28% you increased. 28% you increased tests in comparison of 2 days. Well, it's something you can say, maybe it's of course itself, but this figure which I'm finding is surprising one. 26,567 only. Maybe you want to show people are very healthy or something, but whatever it is, it's not convincing, because still it's telling projection of 36 crores possible infections in this country at present. I'll first of all tell everyone what are these columns. As usual, this is date serial number, this is dates of report, and this is remark. Here it is population indicative only, and this is, you can see here, percentage daily tests, percentage of daily tests in relation to population, and which is very slow. It is now, you can see here, just 0.079% tests conducted daily if you take 130 crore population into consideration. अगर आप 130 करोड़ पॉपुलेशन लें तो हम देख ही सकते हैं कितने परसेंट टेस्ट हो रहे हैं. 0.079% टेस्ट हो रहे हैं हर दिन, जो कि बहुत छोटा फिगर है. एंड दिस इज गवर्नमेंट प्रोवाइडेड टोटल टेस्ट अपडेट. अब तक कितने टेस्ट हुए हैं, और ये यहाँ पर कह रहा है कि अब तक 14,88,14,055 14 crores 88 lakhs 14,055 total tests conducted so far in a population of 130 crores or 1300 million, and this has been achieved in 283 days. So you can see yourself. Then you see percent total tests done on population. This is what it is saying. How many people have been tested percentage wise? 11.447 11.447% public has been tested. 11.447% लोगों का 130 करोड़ में से अब तक टेस्ट हुआ है, और बाकी अभी तक बिना टेस्ट हैं. वो टेस्ट होगा नहीं होगा हमें नहीं पता, हम नहीं जानते, क्योंकि हमें सरकार की नीति का पता नहीं है, ना नीति बताई गई है और ना कोई ऐसा कॉलम इसमें है कि बोल रहा है कि इतने समय में इनका भी टेस्ट होगा, ऐसा कुछ नहीं है. और अब इसमें देखें आप प्रोजेक्ट, इफ़ यू सी दिस वन, डेली टेस्ट कंडक्टेड पर डे, हर रोज़ कितने हुए, जैसे मैंने आपको बताया, कल इतने हुए, परसों इतने हुए. कल हुए 10,26,399, 10,26,399, which is much below than expected number. It should have been more than 1 crore, but it has not been done, unfortunately. We are 90% lower than our speed that must be achieved in testing. हम टेस्ट की स्पीड में 90% की गिरावट पे चल रहे हैं. 90% कह रहा हूँ कि 1 करोड़ से ऊपर होने चाहिए थे, मतलब हम अपने देश का सिर्फ 10% काम कर रहे हैं और 90% काम छोड़ रहे हैं. जहाँ तक कोविड-19 का सवाल है, 80-88 लोग वेट कर रहे हैं. वेट क्या, हमें पता नहीं बेचारों को, मरेंगे जिएंगे क्या होगा. खैर, रोज़ रोज़ की वही बात कर से कुछ नहीं. डेली परसेंट डेली टेस्ट हुआ, टोटल टेस्ट. सो हम बात कर गए टोटल टेस्ट कितने. इन्फेक्शन अपडेट, ये बड़ी इंटरेस्टिंग फिगर है. देखिए इन्फेक्शन अपडेट अभी तक 97 लाख से बता रहे हैं, जबकि सच कुछ और ही होगा. अभी तो हम इन्हीं की बात कर रहे हैं. वी आर जस्ट टॉकिंग बेस्ड ऑन इंफॉर्मेशन फ्रॉम द गवर्नमेंट, एंड दैट सेज दैट 97 lakhs, just 3% or 2.07% short of 1 crore. This is information update, and this government is afraid of showing higher number of people, those who are infected upon. They are afraid to show that, unfortunately. I don't know why, what's the reason behind. And this is here, you can say positive, you can say this is percent of positive infection or total test done. So it is that percentage of total is coming 7.23, average instead of 6.52. So 7%, this is clear saying that this is this crore is direct relation. And here it is total number of daily positive. Then you can say it is daily positive tested, or positive percentage or tested, and here is number of that update. This is here. Well, this is recorded, so I cannot say anything on that. 1,40,958, 1,40,958 लोग अब तक इसके शिकार हो चुके हैं. अब थोड़ा इसके बारे में हम ग्राफ तो दिखाएंगे आपको, थोड़ा चल लेते हैं कि स्टेटस क्या है स्टेट का. यह स्टेट वाइज डाटा, भारत इंडिया कोविड-19 स्टेटस reported on as 8 for this. The status, I should say, reported on 8th 12 2024 7/12/20, and that is, you can say, let me go through jumping. Maharashtra 18.55 lakhs, 18.55 lakhs Maharashtra, and this is 18.55 lakhs Maharashtra, 18.55341 Karnataka, 8.94004 Andhra, 8.72288 lakhs, Tamil Nadu 7.91552 lakhs, Kerala 6.39664 lakhs, Delhi 5.93924 lakhs, Uttar Pradesh 5.56397 lakhs, West Bengal 5.05054 lakhs, Odisha 3.21564 lakhs, Rajasthan 2.82512 lakhs, Telangana 2.7454 lakhs, Chhattisgarh 2.48232 lakhs, Haryana 2.45288 lakhs, Bihar 2.38648 lakhs and Gujarat 2.20168 lakhs, Madhya Pradesh 2.15957 lakhs, Assam 2.13925 lakhs and Punjab 1.56839 lakhs. Jammu and Kashmir 1.13568 lakhs and Jharkhand 1.10457 lakhs. Uttarakhand 778,509 and Goa 4877. Himachal Pradesh 45697. Pondicherry 3727. Tripura 3292. Manipur 26225. Chandigarh 1811. Arunachal Pradesh 1641, Meghalaya 1231, Nagaland 1141, Ladakh 88, Sikkim 52, Andaman Nicobar 477, Mizoram 396, Dadra and Nagar Haveli 33, and Lakshadweep 0. And now we see these columns based on it says like total cases which I'm told you, I told you that active cases is left. Don't much active cases, discharge cases, and that is only for record purpose. I will say here, active ratio and discharge ratio and death ratio. What are these saying actually? This is saying average is 4.59 active case and 91.44 discharge, while 1.23 is increased now. It was 1.19 before, now it's 1.23. And you can say some of these is, this is some of these two. So you can say this is now increased actually. So this is 5.82% and this is 4.59 plus this is 5.82%. This is sum of C8, CD, this one, and these two values are added here to 5.82 result in. Now, what do you say? A 1.19 has gone to 1.23. This means 1.59 crores deaths are expected. Keeping with this data, अगर हम इस डाटा को ध्यान में रखें जो आ रहा है तो उससे लगता है कि पूरी पॉपुलेशन में 11.33 पर इतना आ रहा है. तो जब टोटल पॉपुलेशन अगर इसमें लगा दिया रेशियो में, रेशियो प्रोपोर्शन में, इसको रेशियो प्रोपोर्शन मान के हम इसकी कैलकुलेशन करें तो 1.5935 करोड़ डेथ्स मस्ट बी देयर. Accordingly, if you take whole population and if you keep another 3 months period in eyes and then another 3 months period in eye and then another 3 months period in eye, like that you move, we can say 1.23 results 1.59 keeping whole population, and then 1.53% in 1.99, then means nearly 2 here, 2 crores. And 1.92 next series 2.4. Why I'm saying, first let me tell you what is this one. This is original one that we are getting from CF39, and CF39 is what it is here. This is average of this whole. So this is average 1, 2, 3. And that 1, 2, 3, yesterday it was 1.19, today is increased, and this gives you this much result. It gives you this much results, right? So what we should do, I'll show you last report also. You can see this was 1.19 and now it is, now it is 1.23. This is up to here. So you can say that when I give an increment of 25 here, means in 3 months period, at the 3 महीने में इसको बढ़ा सकता हूँ, 25 कर सकता हूँ यहाँ से, 0.25 इसको किया और 1.53 आ गया, and then another 35% on that in another 3 months, and then it's 1.25 because the compound in it 1.92 and then 2.3, another 25% up, like that, because this is practically possible in 3 months. Further infection cell give more problems, and there will be, you can say, there will be R value. One infects one or one infects less than one, or 1 in fact more than 1, it depends upon that. But we are taking only 25 coefficient, not 1, not less than 1.9 something. We are taking 1 in fact 0.25 only in 3 months, so it's practical coefficient. It's on lower side actually, it's speaking very well. And it's actually on lower side, to be very frank. So I'm just estimating. Then you say another one is 1.25, 2.99, then 3.74, then 5.84, 6.68, 5.84, 7.31. So this gives you this value. This is that one. Because here I'm taking this value, CF. This multiplied by this, or this multiplied by this, you get this one. This multiplied, you get this one like this. This multiplied by 130 crore is population. Population also in crores, you can say. Population in crores, you can say. Crores. All right, so this is in crores. So we are going to get this figure. This is not surprising one. This is very, and this gives a here, you see, this curve is here in that. This is 9.4, so somewhere here. This is the value, crores depth. So you can understand what I'm talking about. मैं क्या बात कर रहा हूँ, आपको इतनी बात से समझ जाना चाहिए कि मैं वो बात कर रहा हूँ जो आप ख्याल में भी नहीं होगी शायद आपके, आप सोच भी नहीं पा रहे होंगे इसको अभी तक, कि आखिर ये 10 करोड़ डेथ जो हम बता रहे हैं, 9.5 करोड़ डेथ, ये कैसे हो सकती हैं कोई बड़ी बात नहीं है, और एक्चुअली कितनी हो चुकी होंगी हम नहीं जानते। हमारा देश इस मुसीबत को झेल सकता है या नहीं, इस बात की बात होगी। अभी हमें क्या चाहिए इसमें? What I am saying is about whole population actions. क्या actions हमें लेने हैं इसमें? What actions are expected and target milestone हमारे क्या होने चाहिए, और कंट्रोल स्केजूल मतलब हमारा क्या स्केजूल होना चाहिए, क्या बार चार्ट होना चाहिए, उसमें कौन से एक्शंस आने चाहिए, कौन से एक्टिविटी आनी चाहिए, वो सब हमारे पास नहीं है। सरकार ने वो नहीं दिया है, और कोई भी ऐसी इंफॉर्मेशन किसी भी और दूसरे सूत्र से नहीं आ रही है। तो ये इतनी मिसिंग इन्फॉर्मेशन है, जो सबसे इम्पोर्टेंट इन्फॉर्मेशन हमें नहीं मिल रही है। दुख इस बात का है, और उसके नहीं मिलने पे हम कोई आगे उसके बाद अपनी इमेजिनेशन कर सकते हैं, सोच सकते हैं, स्केप्टिज्म दे सकते हैं, हाइपोथेटिकल बात कर सकते हैं, और वो हम कर रहे हैं। खैर, ये सब होना चाहिए था, अनफॉर्चुनेटली ऐसा नहीं हो रहा है। इसीलिए अब हम चलते हैं वापस अपने पेज पर, जो हमारा अपना पेज दूसरा बताएगा कि हम कहाँ खड़े हैं, हम क्या कर रहे हैं। कुछ लोगों को शायद बुरा भी लगेगा कि जब देखो बुराई, सरकार की बुराई अच्छा नहीं लगता बहुत से लोगों को। नो प्रॉब्लम। मैं किसी को अच्छा लगने के लिए या किसी को ख़राब लगने के लिए ये बात नहीं कर रहा हूँ, और मैं एक बिल्कुल प्रोफेशनल लेवल पे, बिल्कुल मेंटल साउंड पोजीशन पे रहकर ये बात कर रहा हूँ। मुझे कोई इंटरेस्ट नहीं है किसी पॉलिटिकल ग्रुप में या किसी की सोच में कि आप कुछ भी सोचिए, आपकी इच्छा है, मुझे कोई फ़र्क नहीं पड़ने वाला। लेकिन एक बात मैं बता देता हूँ, पिछले 4 दिनों में 47% तक टेस्टिंग कैपेसिटी गिरी थी। पिछले 4 दिनों में 47% तक टेस्टिंग कैपेसिटी गिरी थी। आप ये देख सकेंगे यहाँ पे 11.7 था, 11.57 हुआ, फिर 11.01 हुआ, और फिर 8.01 हुआ। आई मीन टू से 11,70,000 से गिरकर 11,57,000 आया, उससे गिरकर 11,01,000 आया, और उसके बाद 8 लाख आ गया, और आज फिर 10 लाख। ये खुद बता रहा है कि हम कहाँ बैठे हैं। अगर आप देखें, सोचिए थोड़ा सा, इसमें कोई भी रेशियो, प्रोपोर्शन, यूनिफॉर्मिटी नहीं है। ऐसे लगता है दिल में आया काम कर लिया, दिल में आया सो गए, दिल में आया कोई मरीज उसको अटेंड कर लिया, कहीं कोई टेस्टिंग मशीन इक्विपमेंट है नहीं है, कहीं डॉक्टर है नहीं है, कहीं कोई स्टाफ है नहीं है, कहीं कोई अस्पताल काम कर रहा है नहीं कर रहा है। इन सब बातों से हमें कोई फ़र्क नहीं पड़ता है। और जब इन बातों से हमें कोई फ़र्क नहीं पड़ता है, बहुत अच्छी बात है, बहुत बढ़िया बात है, सराहना करनी चाहिए। जब देश इतना लापरवाह हो जाए, कोई चिंता ही ना हो, अस्पताल है नहीं है, लोग बीमार हैं नहीं हैं, लोग टेस्ट करा रहे हैं नहीं करा रहे हैं, जब ये बातों की विश्वता ही ना हो, आवश्यकता ही ना हो, तो उससे ज़्यादा अच्छा क्या होगा। This data itself is telling that about 4-5 days itself is telling what actually we did. You can see yourself 10.96 have gone to 11.11 lakhs and then 11.7 lakhs and then down to 11.57 lakhs and down to 11.01 lakhs and down to 8 lakhs and down to 10.26. This is simply telling there is no control, there is no organization, there is no care, and whatever is going on hazardly or haphazardly. We do not care for that. We have no monitoring status there. Nobody is monitoring what's happening, why it's down and why it's up. Nobody is interested to know about that. Really? It's surprising, but on the other hand, they are saying that, you see, we have reduced number of positive cases. Now you tell me, what contribution official people have to this? Is down by nature probably. And you can see yourself, you go back, you would find there, you can see high figure like 90,000, you can say 90,000 here, 90,000, 75,000, 89,000, 95,000, 96,000, 97,000, 70,000, 86. Tell me any place you can say here is there you can find some level of uniformity or some case leveling, or you can say status leveling is all varying, completely, you can say complete. No, there is no scale here. There is no scale here. So that's where is my worry. Now they are saying they want to show only that we yesterday had 26,000, so we have come down from that. This is more interest for government. This figure clearly tells that government is interested to show to whole world that our situation of COVID is coming down and we are in control. That's what they are saying. We are in control. This is called manipulation. I call it manipulation. झांसा कहते हैं हम से, झांसा दे दिया। झांसा समझते हैं ना, बेवकूफ़ बना दिया। जो वास्तविकता थी वो छुपा ली और जो वास्तविकता नहीं थी वो बता दी। ओके, दैट्स फाइन, एवरीबडी शुड डू लाइक दैट इन पॉलिटिक्स. It's government, it should not say we are not working. Of course, nobody will accept that, but you are working or not working, that is not evidenced by your statement. It should come from circumstances, it should be seen, and that's important. वो दिखना चाहिए कि आप काम कर रहे हैं, और वो नहीं दिख रहा, इससे कि इसकी रेशो में अगर आप देखें और आप जाएँ तो आज भी ये बता रही है फिगर, और ये बता रही है फिगर 1124 अभी भी है, और ये 36 प्रोजेक्शंस अभी भी हैं, बढ़ गए, ये 36.66 हो गए, क्योंकि आपकी तरफ से कोई भी ऐसा इंडिकेशन नहीं आ रहा है कि टेस्ट में कुछ इम्प्रूवमेंट है, टेस्ट बढ़ रहे हैं, ऐसा कुछ नहीं हो रहा है. आई एम नॉट फाइंडिंग एनी इंडिकेशन from your records that there has been some updated efficiency or some increased efficiency on testing front. No indication is seen here, no indication visible that cases have been increased to 30 lakhs or 40 lakhs. It's only, you can say 10 lakhs, which is lower than 11 lakhs, the common scale we used last time. So our testing average is 10 lakhs 23,766 per day, which is not acceptable in fact. And this is where problem lies in. And if you see graphics of this, you can say still It maintains that standard as it was before, only it's down because of this value. Otherwise, another value is being constructed here. This value will move like this later, and then like that, and like this. So this valley reaction, mountain valley reaction, mountain valley design. As you can see, this is a mountain valley. This is hill, and this is hill, and this is valley. This is hill or mountain, and this is valley. This is hill and this is valley, this is hill and this is valley, like this. You may say it's up and down. Mountain is created and hill is created. Mountain is created and hill is created, like this. It's going like this, means there is no standard trigonometrical curve, we can say. It's just moving as if it's a terrain of which valley, which I don't know, which mountainous range it is. I cannot say. That's it is about. So what we are now means still status is saying there is no drop. There's a drop, and this 28 I'm showing there's an increase yesterday, and before yesterday, day before yesterday, that was 8 lakhs and it's gone to 10 lakhs. So there's some increase. It was 47 drop yesterday. Now it's 28 up, but it's not to that level. As I said before also, that we have to increase, and this if you consider resource augmentation, which there's no indication about. There's no indication about, we are going to enhance or augment our input of resources for tackling COVID-19 or for moving with people. There's no such indication. And if I maintain months 3, means this is not going to work whatsoever, because there is no indication of resources. If you take 6 months here, 6 months, so that's also not going to work. Nothing is going to work here, because actually it's going to take 11-24 days. That's important. So 11-24 days, if it continues, otherwise this is just a legend, and we can say this figure, that is, this 36 crores we can expect today. मेरे हिसाब से, हमारे हिसाब से, डाटा के हिसाब से, इतने लोगों को अब तक देश में 36 करोड़ लोगों को, 36 crore people might have been impacted upon by COVID till now. Maybe they are not aware of this. खैर छोड़िए, अब इन बातों से कुछ रखा नहीं है, और मैं आज ज़्यादा बात भी नहीं करना चाहता, क्योंकि कोई ख़ास मुझे एंकरेजमेंट नहीं मिला अभी तक डाटा से या लोगों से भी मुझे कोई एंकरेजमेंट नहीं मिल रहा, जबकि इतने इम्पोर्टेंट बात मैं कर रहा हूँ। शायद आप भी नहीं समझ रहे होंगे, मैं भी नहीं समझ रहा, आखिर ऐसा क्यों हो रहा है, नहीं समझ रहा। देश क्या चाहता है, लोग क्या चाहते हैं, मैं नहीं जानता। मुझे नहीं पता कि लोग क्या चाहते हैं, क्या समझते हैं, किस दुनिया में रहना चाहते हैं, अंधेरी दुनिया में, जहाँ से हम अगर ठोकर लग जाए, और लग रही है ठोकर, तो हमें लग रही है, वी आर बीइंग स्टम्बल्ड, we are being stumbled by various stones which are lying on ground in darkness, and there's no light. We cannot see those stones fixed in ground or available in ground, and we shall be stumbled again and again, until we are injured very well or wounded, and that's what's going to happen. There is no partiality in this data. This is based on facts and calculations, and I will try to give you more and more information as I find some reasonable and weightful analysis in this. But till now, I don't think something is coming well. But just for information, I would say that people should rise to occasion and consider all population as their own family. Otherwise, that from case to case, if you go, if you are sick only, then you'll be tested. That is, I don't think that's the best way to tackle this problem, because if someone feels sick and they are tested, and others don't feel sick and they're not tested, we cannot find solution in this way. We have to change our style of working. We have to change ourselves. We have to think that everybody should be tested. That should be philosophy. That should be program. That should be, thinking power. Otherwise, this problem cannot be tackled. If you think it will go away on its own, yes, it will go on its own after injuring more than 50% population. In that case, what can you do? That's the main point here. I'm not going to main talk again and again. I will talk only later on when we get more and more data. Reasonable data, the same data I'm getting every day. There's no meaning in talking unduly. So I will say that you rest with this and enjoy and speak that very good work is going on. Everything is fine, and the government say accept that. So act like a yes man and not a cross man. Every citizen has a right to speak against something or in favor of something. Her question is, are we serious? My answer is, we are not serious. We are not alert, and we are not intelligent enough, and we are not courageous enough. And we are accepting everything. We accept everything all the time. It's my country, it's your country. Accepting without risk is fine, but accepting with risk is not fine. We are accepting something, we are accepting everything fine, okay, everything is fine, but risk stands there. Risk is involved there. Highest degree of risk is involved here, which we should think about. Unfortunately, we are not thinking. So with this, I should say, if you are not alert, you will lose everything. That's also important. And it's all I can say. So if we are not so serious, I can't help it. I thought people would be happy, they would be interested in knowing more and more. But it seems that our country has changed its culture. हम लोगों ने अपनी संस्कृति को बदल दिया है. बोलने की संस्कृति, क्वेश्चन करने की संस्कृति, लिखने की संस्कृति, पढ़ने की संस्कृति, सोचने की संस्कृति शायद सब खत्म हो गई है, ऐसा लग रहा है. कोविड की वजह से नहीं, वैसे भी हम एक डर की दुनिया में जी रहे हैं. वो डर जो किस चीज का है मैं नहीं जानता. अगर आप राजनीतिक नेताओं से डरेंगे तो देश तो बर्बाद हो जाएगा. देश बर्बाद ही है. क्यों डरे भाई इनसे? क्या लिया हमने इनसे? मैंने या आपने इन राजनेताओं से क्या लिया है? इन राजनेताओं ने शुक्र मनाना चाहिए कि आपकी वजह से ये वहां पहुंचे हैं, और हम डरे इनसे? नहीं डरेंगे बिल्कुल. मैं नहीं डरूंगा. कोविड शायद इसीलिए आया आपको समझाने. अगर आप कोविड की भाषा नहीं समझते तो आप अपनी भाषा क्या समझेंगे? अब मैं राजनीति की बात नहीं करूंगा यहाँ पे, क्योंकि फिर आप लोगों को गलत लगता है. मैं इतना कहूंगा, ज्यादा उल्लू बनना अच्छी बात नहीं है और ज्यादा बेवकूफ बनना अच्छी बात नहीं है. आप में हिम्मत होनी चाहिए आवाज उठाने की. You must have courage to raise your voice. That's very important. If you don't raise your voice, you are a slave. Why should I be slave to someone? It's not slavery time. Every citizen pays tax. Every citizen pays money to state, to government, and government is supposed to work in lieu of that. It's my question, it's my assumption, and it's my plea. Are they working? If they are working, this report should be different. It's not. Every day you are going to find same projection, little variation, this and that. For example, why speed of testing is low? I've not seen this in any newspaper. I've not seen this question anywhere else. Nobody's questioned this. Nobody's questioned that. Some political parties questioned before, but now two are silent. So who shall question? I should say, irrespective on party line, irrespective on something else, it's duty of every intellectual, it's duty of every person having brain, having some courage to raise this question. COVID is not politician, COVID is not economy, it's a destroyer of economy, it's a destroyer of society, it's a destroyer of health, it's a destroyer of safety. So we have to think that way. Safety is responsibility of each and everyone. Health is responsibility of each and everyone. Like environment is responsibility of each and everyone. Each and everyone, I'm saying, not only this country, all countries too. Every citizen of the world is responsible. We are talking about our country. We have to be careful in this. It's my responsibility, your responsibility, everybody's responsibility to think how to get rid of COVID in this country. But who is thinking? Are you thinking? No, you are not thinking. I am not thinking. I am also talking. I am talking for something. Other problems do exist there. It doesn't mean this problem should be ignored. The government is trying to ignore this, unfortunately, because there is no program. I did not find any program for last 3 months, what they want to do. Of course, I am a very small person. Government shall not read my post, I know that. I am not a celebrity. But it's not question what you are. Question is, even if I don't write, I don't speak, do you think it's not job of government? Do you think it's not public job? It's job of both government of this country as well as people of this country. It's job of both. Because people have more weight and government has more resources. People have more weight. Your voice weighs more than Prime Minister's voice because you are people of this country. But you should be united and you should be uniformly thinking. Cohesive thinking is required. There is no thinking, to be very frank. There is no thinking. Whatever we have done so far, I can say direction of government, we have just wasted everything. We did not see scientifically, we are just moving in a direction we should not go. We clapped something, we rang thalis, we went on the balconies, we played with divas, we played with valleys. What did we get by that? Nothing. You tell me, did we get something by conducting all those activities which had nothing to do with COVID, but just an imagination, just a delusion, just the orthodoxism, just paradoxism? Did you get something out of that? We got nothing out of that except just fake belief, false belief. If you do like this, 130 crore people do like this, they ring this, or they stand in balconies and say, go back, Corona. Shall Corona go back? That's my question. Has it gone back? So don't be orthodox. Don't stay in paradoxism. Stay on facts. Stay on reality. That is required. If you can, it's fine. If you can't, it's not. I am not inciting anybody, and I don't want. But if you speak facts and if you listen, it's fine. If you don't listen, also it's right, because you are not concerned with your country's problem. Country's problem is not only job, it's not only economy, health is number one. If health is spoiled, your economy shall not help you, your wealth shall not help you, because you suffer physically and mentally. Do you want to suffer forever? It's up to you. Again I am telling, a big problem is awaiting us. We are waiting for a big problem. It's going to impact on us soon. If you are interested in solving that, think on this. Force government, all governments, to push testing and arrange more and more treatment centers, because everybody cannot afford private homes or private isolation rooms and big hospitals. I would stop here. It's up to you whether or not to think about this. When I get good data, I will be back to you.